there, Sarah here. Thanks for taking the time to sit with me for this presentation on narrative discourse formulation in children with head injuries. In this presentation, we're just going to go over some definitions and some studies that were conducted in this area and their findings, as well as the clinical implications. A closed head injury, or CHI, to the brain doesn't involve any kind of penetration into the skull or tissues around the brain. CHI is most commonly caused by car accidents like car versus car, or car versus pedestrian, or maybe car versus a bike, falls, sports-related injuries, and also they can result from a severe lack of oxygen, such as near drowning or cardiac arrest. The Glasgow Coma Scale is used to determine the injury severity. Higher order length, particularly impaired in pediatric and adult traumatic brain injuries, or CHI, including discourse skills and understanding of irony and non-literal concepts. Younger children with these brain injuries may present with impairments in both lower order, like semantic and syntactic, and higher order levels of language. Narrative discourse is a monologue that is tied into cohesive units by linguistic markers and thematic unity and is used to give reports of what happened or imaginative stories. Expository discourse, on the other hand, conveys factual or technical information and is the type most commonly used in educational situations by teachers to instruct and by students to demonstrate their knowledge of a given topic. So in this presentation, I'm going to talk about two different studies with the same basic purpose. And the authors of each study wanted to know if children who have closed head injuries suffer more language impairment, and also how is narrative and expository discourse affected after brain trauma. In the Hay and Moran study, 9 kids who had closed head injuries were compared to 9 age-matched children who were typically developing. The ages of the kids in this study ranged from 9 years 5 months to 15 years 3 months. Language variables like the number of words, the T units, and sentential complexity, as well as information variables like the number of propositions, number of episodic structure elements, and number of global structure elements were tallied. And, which I thought was kind of cool, the authors assessed the children's ability to derive a story moral or aim. Working memory tasks like the non-word repetition task and the competing language processing task were used as a way to measure working memory ability. The results definitely indicated a significant difference between the performance of the closed head injury group and the control group, and I'll talk about that more in the next slide. Here we can see the results of the Hay and Moran study, and in each category you can see the age equivalent peers scored better than the CHI group. It's interesting to note that both groups scored better on the narrative discourse versus the expository discourse. Another interesting bit that these authors put forth is that they said the children with CHI can tend to score within normal limits on standardized language assessments, which can lead to falsely favorable prognoses. The other study I want to talk about, the Chapman et al. Study, compared 74 children, and they ranged in ages from 8 years to 10 years 11 months. 24 kids in this study had closed head injury, 25 had language impairment, and 25 were age-equivalent controls. There was also a subgroup of children in this study, and they had closed head injury as well as language impairment. The children with closed head injury chosen for this study had moderate to severe head injury 3 months prior to the administration of discourse measures. Severity was measured using the Glasgow Coma Scale mentioned earlier. Vocabulary knowledge was assessed using the Peabody Picture Vocabulary Test, and a narrative task, which utilized the Two Roosters fable, measured the discourse ability. And the results of the Chapman et al. Study showed that the closed head injury only children, meaning the closed head injury only and not language impairment also, those kids had the most problems in the information domain, specifically with episodic structure. And the children who had both closed head injury and language impairment used more complex language than the kids in the language impairment category, but the information was fragmented and difficult to follow. The children who had language impairment performed more poorly than their peers on all discourse measures. As mentioned earlier, the goal of both of these studies was basically to figure out if kids who have closed head injuries had more language impairment than their age equivalent peers, and the answer to that is definitely yes. From both of these studies, we can see that the closed head injury kiddos suffer more language impairment, and they also have more difficulty with narrative and expository discourse. I think a really important take-home message from both of these studies is to remember that traditional measures of language may often underestimate the communicative disabilities of kids with a history of closed head injuries. Nonetheless, traditional language measures should be routinely administered given the prevalence of an associated language impairment in approximately 1/3 of children with moderate to severe closed head injury. So how can we apply the knowledge from these studies? Well, improving information content and language structure is forefront in helping kids with CHI overcome language problems. Teaching a more organized schema for presenting information and increasing ability to utilize memory strategies for storing and recall information would also be useful. Helping the student transform information beyond the concrete level, such as like story morals, increasing recognition of main points, and increasing comprehension of the passage as a whole, are good places to start. In this presentation, we covered some definitions related to closed head injury and discourse. We talked about the Hay and Moran study as well as the Chapman study, who found that kids with CHI definitely struggle more than their peers with language, and we discussed some of the clinical implications for these findings. Thanks for watching.